of Infrastructure. Last week, I asked the Minister of Infrastructure about his department's decision to more than double the rent paid by the Mary Berglund Community Health Centre in Ignace. In response, he stated that they were paying $5 a square foot for basic rent. He neglected to point out that his figure fails to include the compulsory O&M fees, realty tax, and management fees, and all of the repair costs, which brings their triple net lease to $228,022.63 and translates to $23.77 per square foot. But the minister should know this because he has access to the same information. My question is simple. Is the minister prepared to make this situation right instead of continuing to deny the facts?
Thank you very much, Mr. Speaker. I don't think we disagree. The base rent is $5. It was $3.50. Every other health centre, the ones in my constituency, pay base rents much higher than $5, $12, $20, $25, plus have to pay on top of that. I have said many times to the member that we are trying to work with them, and there has been a significant communication between my office and Mary Berglund to try and sort through how we can do that. Obviously, $3.50, which was the base rent, is before it was raised to $5, is a relatively modest rent. I appreciate the challenges that the health centre is facing. We are working with the Ministry of Health right now, who have correspondingly increased their grants to do that, to try and figure out a way in which, either by looking at the amount of space or the storage space, to find a solution to it. But they are not paying ordinarily high rents compared to other health centres. Thank you.
Parliamentary.
CHC has been trying to resolve this issue for 3 years. Whenever the issue is raised in question period or through letters to ministry officials, the response from the government is never grounded in accurate information or correct figures. This rent is so unaffordable that already they've been forced to lay off staff, and the executive director has voluntarily given herself a pay cut to help pay the bills.
Wow.
The executive director is so desperate to resolve the situation and protect the viability of her CHC that she has traveled to Queen's Park today, and she's sitting with a board member in the gallery. Will the Ministers of Infrastructure and Health and Long-Term Care meet with the Executive Director today, after question period, to finally resolve this issue?
Mr. Speaker, the short answer is yes, of course. And I had committed to the member from Kenora-Rainy River that as soon as this House rises, I would come to her constituency to meet with if it wasn't solved by that time, and I will maintain that commitment. If we cannot resolve it before the House rises, I will come up and view the situation personally. I would also be interested in the details of the funding formula, because the LIN funds increases to health centres. And if there is a gap there, or there's information that we may be missing, I would be quite happy to be so informed. The challenge is, and this is a challenge across government, Mr. Speaker, I wanted to say this so all members understand. We were charging historically over the last many decades different rents, so there were hidden subsidies. The idea now is to get to a full cost recovery, members, so that everything is fair and transparent.
Thank you.
If in that process there's been problems, we'll correct.
Thank you.
Thank you.